So we have Lisa on the end, who's a senior physio with MDQ, Christina, who's one of our senior OTs, Vicky, who's recently joined us as a social worker, and we were absolutely delighted to be able to put that position on, which I'll discuss in a little bit. And lucky last, we have Rosalind, who's one of our support coordinators, and Rosalind's bravely stepped in because Joachim Tan, who was scheduled to present today, was unwell. So I hope you enjoy the session. Thank you.
So this is a question and answer session. I have 3 pre-written questions from the audience, and I have a few from online. I'll start with one of the online questions. When looking at participants' requests and supporting them, what are the key principles adhered to around what is basic and necessary? I'm starting with Ros, the support coordinator, but it may be also relevant for the therapist.
Everyone's different. So what's basic and necessary for one isn't always basic and necessary for another. So it's about knowing the individual participant and what their needs are, knowing their plan, the recommendations, and working within what they've got, to support them to get their basic and necessary, because everyone is different.
That's right. And just to add to that, I guess everyone's goals obviously do need to be within the context of reasonable and necessary, but I think that's dependent on your disability. So I guess it's thinking, am I requesting this support or this piece of equipment or whatever it is because of the disability that I have? And so I guess potentially looking at peers and their life choices and what they're doing and wanting, and if you want to achieve that too, what do you need to be able to achieve that?
And I think in terms of justifying assistive technology and services, thinking what would my same age peers be doing and how can I do that? And what do I need to do that as well? And I think that's what we put in our AT applications over and over again. So next question, is there a difference between CPAP and BiPAP, and how do I know which one I need?
Okay, so from the lecture today, you would have seen that it was mentioned CPAP and BiPAP. So BiPAP is for clients with more severe muscle weakness and they don't breathe deep enough. So they need that support for when they breathe in and then when they breathe out. And then other clients can get diagnosed with sleep apnea, which is often treated with CPAP. So that's continuous positive pressure ventilation. And we see that with clients that often have myotonic and they don't have as much weakness in their breathing muscles, so their diaphragm and their intercostals. So other conditions like Duchenne and Becker muscular dystrophy, limb girdle, as well as FSHD, and some clients have BiPAP because they're a lot weaker in their trunk muscles and their diaphragm. So I hope that explains it.
And it's determined by your medical team what device you have, and it's dependent on blood results and sleep study tests. What does your social worker do and how can I access the service?
Thank you. Well, I've been in the role only for a few weeks, so I would like an answer to that question myself at times. No, but this has been a 2-year funded grant from the NDIA. So the social work that we're doing at MDQ is not coming out of individual plans. I really want to emphasise that it doesn't impact on the other therapies and supports you want to access in your own plan. The social work service came out of, this was well before my time, a long, history of MDQ and other organisations in having some social work capacity prior to NDIS and a little bit post to be able to support people, particularly around times of diagnosis and transition, what was happening, with degenerative disease progression. So offering some, someone to talk to, some emotional support, some linking into other services and supports outside of what, formal services may be on offer. So at MDQ, we're looking at offering up to 4 social work sessions with myself and outsourcing some of that as we can as well. And those referrals have come through anyone who's registered with MDQ. So I've met a number of people so far connected with MDQ and offered some phone support, some face-to-face. I try to do as much face-to-face as possible. And part of that grant is also peer support and capacity building. So linking, people in with each other, supporting some of the initiatives already happening out there, that are around. So that's in a nutshell for the work that I've been doing to date. But there's lots of lots of ideas of how this role could develop and the social work service and program can develop. I'm part-time, so work 18 hours a week. So, yeah. Yes, there's been a couple of self-referrals, so anyone can self-refer. Susie is the first point of call for most people with MDQ. So Susie has referred on from sort of self-referrals through the support coordination team and allied health team. Yeah, so that's how the referrals have come. And it's really just, it might be a allied health person saying, Vicky, I reckon this person may, require a bit of, or, might like a bit of extra support. So we'll have a conversation, obviously talk to the client, the family, say there's something you'd be of interest to you. So that's sort of the way it's been so far, but certainly welcome, any ideas, or if you've got, connecting up with different other services for ways for people to hear about what we're doing.
Functional capacity assessments. What are they? Why do they cost a lot? And why are they worth it?
They often are done by OTs, and probably lots of you will know that they take a lot of time, that you get asked a lot of questions. So it's quite a detailed assessment of your day-to-day life. So it takes time to do that initially with the person, and then lots of time to score up all those assessments and to write the report. And I think the reason that it's great if it is quite detailed and very accurate is that it will be used to justify all the requests made to NDIS for equipment things or support needed day to day. So it needs to be excellent justification for why all the things you're asking for are reasonable and necessary. And often there are recommendations at the end of the report, and yeah, they need to be backed up by all the assessment that came beforehand. They can track deterioration. That's exactly right. Yeah, and that's why often it's good to have one done annually, most often, because it does track changes in need, and I guess it helps the people who are reading it to understand that, there can be a change in condition, and that's why something's needed now that wasn't needed previously.
So I did have a planner this morning that had actually read one of our FCAs, so they do read them. For me as a support coordinator, I also read through them, which when we take you to a review, we're able to break that, recommendation from the therapist and say, this is why it's essential. So the details that the therapist put in, that's why we chase reports from kind of everyone. They put it in that report, and then we take it to NDIS for that justification on why you need that essential support.
Just staying with you, Ros, what does a support coordinator do, and can everyone get one?
Everyone should have one. Depends on the plan you get on the day, unfortunately. My role is gathering all of your information, all these reports, taking you to review. I go through your plan. I put supports in place. The biggest thing is giving you the options, helping you understand your plan, what you can and can't have within your plan. It is choice and control. So, there's always going to be things that we go, NDIS don't approve it, but if you want it, you know, that's a risk to yourself. But my role is to assist you in getting the best out of your plan.
This is a physio question. The current NDIS supports advise support workers can be funded to help with passive exercises. How can this be assisted by using capacity funding to prescribe and train them?
So some clients are unable to do a lot of active exercises, and specifically clients also that are full-time wheelchair users need stretching programs. So that's passive exercises. So often we go in and teach the support workers on how to do these stretches and passive movements so that we can maintain joint mobility and muscle length and manage pain. So we often go in and train them and write out a program and then review it as required. And then that way, you know, it maintains sitting comfort. So it stops you getting joint contractures, postural changes, things like that.
And that's part of our role, is to devise a program and train support workers and review the program as needed. Prescribing equipment. What do people need to be thinking about to get the right item and avoid issues down the track?
I'll do the wheelchairs first. I guess when you're looking at mobility aids, that's when physios often come involved. So I guess you've got to look at your baseline level of mobility, and also like your functional impairments and also your environmental barriers. So if you've restricted yourself and you can only walk, say, 50 meters, like what do you need to walk beyond that to go complete an activity or a goal that you've been doing your whole life? So, you know, if you like going shopping, but you're not able to walk around the shopping centres, what kind of mobility aid do you need? How are you going to transport it? And what else do you want to use it for? Do you like going to the park? Does the park have grass? You know, is the park hilly? Like there's multiple factors to consider, but you often have to look at customized solutions to maintain your comfort level and meet your goals, meet your needs, and, you know, achieve a higher level quality of life and age-related outcomes. So you're doing what everyone else your age is doing, and, you know, yeah. So there's lots of things. Equipment in the house is more Christina's.
But it's a bit tricky to generalize, I guess, but I'm sure you all know that you have something in mind that you want and it needs to fulfill a specific goal, and I guess extended trials, if you can trial something for quite a while before you make decisions, and if you can think about how will your use of this bit of equipment be different in 6 or 12 months' time. It's all those kind of things that hopefully we will help you to think through to make the best decision for what's going to work best for the longest time.
And I guess NDIS have they like equipment to last 5 years, and sometimes it's a challenge when you have a deteriorating condition to even know what you'll be like in 5 years' time. So to find something that suits now but can possibly be adapted if needed down the track. So that's where the OTs and physios help out. Cough assists, who and when should they be using them?
So cough assist devices are devices that help you cough when you're able to uncough yourself. So when you have a weakness in your coughing muscles, your diaphragm and your intercostals, you can get a machine that blows air and then has a suction force. So usually it may be prescribed from your hospital team, so your clinical team. will suggest that, and they may trial it in hospital trial of a cough assist device. Many conditions get cough assist devices very early, so teenagers can have cough assist devices. But you got to just make sure that your specialist is aware and your respiratory team at what hospital you're located at. And they are funded by NDIS. So we apply just like a wheelchair. We put in an application to NDIS, and we have our own stock, so we can hire out cough assist machines to people that are in need. So especially in winter months, so everyone starts to get sick. But otherwise, yeah, you have to fall within a certain perimeters, and it's often found on lung function tests. So when you go to hospital and you breathe out into the tube really quick, you can tell by the measurements whether you may need a cough assist device or not. Yeah, so I think that's all covered. Yeah, so it's all about getting the secretions. So removing your secretions, yeah.
So I'm just checking, Sarah, are there any other online questions? No. We just have a couple more. NDIS participants don't know sometimes what they don't know. What are some things that are rarely funded but hugely useful for people with muscular dystrophy that people may not be aware are even possible? That's a big question.
I can see Emma nodding. I feel like maybe you should answer this. Because I think what I'll pass it back to but I think what you said about being connected as much as you can in whatever way you're comfortable with other people who have a similar condition can often be really helpful, because I imagine that's often a way of learning what is useful for someone that could be useful for you too. So there's potentially some people in the room who have some great responses, but I'll
physio-wise, I guess thinking about your leisure pursuits and your hobbies and things like that, really thinking about what makes you happy and fulfilled. And so if you live right next to a beach, and if you go to the beach often, yes, you can, try and get a beach wheelchair and things like that. So it's not just for things inside your house, and it's not just for supports inside your house. It's for supports to allow you to go out in the community and experience hobbies, leisure activities, social activities, interact with people. And yeah, so like out of the box, I guess, asking your treating therapist, like often they will be able to tell you if something can be approved or not. But reasonable and necessary is different, and it can always be for everybody. And what's reasonable and necessary for you is not the same as the next person. And you can always fight for something as long as it's part of your goals. And that's why you got to really think about what you write on your NDIS goals, and that you cover everything that's important in your life and not just the day-to-day stuff.
Yes, you can update them at any point. You actually just have to send them to the NDIS inquiries with your plan, like your details, so your NDIS plan number, and they will upload them and update them. No, they'll just update your goals for you.
And I guess in terms of the question, talking to each other as well and being part of peer support groups is often a good way of information sharing and finding out what's out there and what other people have done. And one final quick question for all of you. In a one-sentence answer, what drew you to working with the Muscular Dystrophy Queensland community?
Being able to make a difference at a higher level, I suppose.
I think I just fell into working with neuromuscular conditions a long time ago and enjoyed it and got stuck. It's where I'm meant to be, hopefully.
I guess as previous client experience in early in my career and thinking out of the box and not just, exercising people to gain lots, really improving quality of life through equipment.
Brief time to think. I think the opportunity when I saw this role come up and exciting to kind of for me, but a full circle because I started my career many years ago in disability and have done lots of different things in my sort of social work role. So coming back to do this work.
Where are we?
Yeah, just one quick question. You were saying about getting an assessment done sort of every 1 to 2 years, like on a
Functional capacity
physical.
assessment.
You get that claimed on NDIS?
Yes,
Okay,
Yeah.
all right. Thank you very much.
it's
for that.
funded. Yeah.
Yeah, and I'll give my tip. Get your car cleaned on NDIS.
As long as you've got the hours in your capacity building budget. Yep. Are there any other questions from the floor?
Don't want to put you on the spot because I know it's new, but I'm really worried. I am a bit concerned about the change in the new funding model and moving on to the funding periods. And I'm guessing it's probably going to be an issue for many people with unstable conditions like most neuromuscular diseases are. I know the worst problem is probably going to be that first quarter, but have you had any information or how receptive are the NDIA going to be, do you think, in listening to us to account for that instability?
Ros, all right. That change, I'll come around to you, sorry. That change came into effect on the 19th of May and was circulated by the NDIS on the 21st of May. So our plan management and support coordination teams have been group huddling to work out what the changes mean. We've already seen plans implemented with a 1-month funding period and others with 12-month funding periods, and we know that each funded category can be funded at different durations. I agree, Emma, I think that it may not be the most suitable funding model for people with episodic use of their plans, but it's kind of 1 month seems to be applied to consumables and things that get used quickly, and the NDIS wants you to eke that out over and have it last for the entire period of your plan. We've been doing quite a bit of work with people who have hit a wall with their negotiations with the NDIS and have just reached a point where their resilience is failing and they're sick of the bureaucracy. And we've had quite a bit of success in helping people have yucky decisions overturned. So if you are experiencing some time where you've been waiting for a change of circumstance or you've had an unfavourable decision made, please reach out to us. It's one of our charitable services, and we do have capacity to advocate on your behalf through the agency where we can. So please let us know if you're struggling with those kind of things. Did you? Okay, well, that brings us to the end of the event. It has been so lovely to see so many faces in the room, those familiar and some new faces as well. And I'd like to particularly acknowledge the people who've joined us via Teams today. Not always the best experience when you're attending a face-to-face conference through a digital channel, but we hope you found that to be valuable as well. I know that Vicky touched on it, but The event today was funded through a new grant that we received that was confirmed in November last year from the NDIS, which is peer support and capacity building. And it is a 2-year project that funds information, community connection, and we've been able to extend that to bring on the social work service. So we're really grateful for that funding, and we think it'll make a big difference for the supports we're able to provide, not only for people who have individualised funding through their plan, but for the whole community. So this is the first time since 2017 that the government has funded services directly through MDQ for that broader community. So we're really grateful for that support. Previously, though, and after that 2 years ends, because it's a time-limited grant, these kind of activities are funded through philanthropy. And I won't push that point again because Emma made such a good point before, but it is through the support of the community that we're able to deliver these kind of programs. So your support really does deliver services back into the community. And I just wanted to touch on a point that the team principally work through funding in the NDIS, but everyone here also provides pro bono support outside of their NDIS funded tasks. And so if you don't have an NDIS plan, and they're particularly for a functional capacity assessment to help with a plan review, if there's equipment that might make a difference for you, we do have charitable models where we're able to assist. So please check in with us, reach out and just let us know how you're going, and we'll do what we can to make a difference. Okay, so that brings us to the end of the evening. Thank you all for coming, the afternoon. Thank you all for coming.